Hello team, this is Elijah Burks, your infection control officer for the region, and I want to introduce you to a benefit that we were afforded by the state of Texas of some COVID test kits. These are the rapid antigen test kits, and I'm going to show, with the help of my coworker Michael Thompson, we're going to demonstrate how you can use this test at home to check to see if you've been exposed to COVID-19. So, you're going to have, what you want to do first if you're at home, wash your hands. Wash your hands thoroughly. If you're in the office, then use the alcohol gel. Now, I'm going to wear gloves at this point. Now, you're going to be doing this test on yourself. I highly recommend that you do that to limit exposure to others. So, what you want to do first is set up your clean field. So you can use some paper towel. Go ahead and lay down your clean field. Now this test kit comes with 20 tests in a box. But for training purposes, I'm going to show you the 4 components that you're going to use for this test. The first of which is the nasal swab itself. Let me pull it out of here. Now this is the nasal swab. You got the antigen, the test kit itself. Then you have the derivative that you're going to put the nasal swab in and the cap that goes over it. So you got 4 pieces here. All right. Now Michael, I'm going to have him take the swab, and he's going to administer it to both of his nostrils.
And this is the painful part.
Right. Now, what you want to do is you go all the way up into your nostril until you feel the discomfort. And once you're there, you're going to swab it in circles 5 times, very vigorously. And then repeat the process with the next nostril. All right, very good. Now, holding that in one hand, you're going to pick up the antigen tube, and you're going to remove the cap, and then place the swab inside the antigen tube. Now, you're going to grab the bottom and squeeze it very tightly, and then you're going to twist the swab multiple times, as many times as you feel as though that it takes to get it mixed in. You're going to squeeze the bottle and twist the swab. All right, now once that is done, you're going to take the top, place that back inside like Michael did. You're going to place the top and push it down until you feel a click. Sometimes you might not feel a click, but make sure it's firmly on top of the antigen vial. Now, you're going to open up the test kit itself. Place the test kit on your clean field. Now you're going to take the antigen vial and you're going to apply 3 drops to the square at the bottom. 1, 2, 3. All right. Now at this point, you're going to wait 10 minutes. And it's going to start revealing whether you're positive or negative. Keep in mind, team, that sometimes if you're positive, you're going to know it as soon as you apply the drops, but not necessarily. Sometimes people have very low antibody involvement, and it takes 10 minutes or more before it reveals. So don't make any assumptions until 10 minutes. If it is positive, then that is clear that you need to take measures. Notify your supervisor at that point. Supervisor, in conjunction with yourself, will notify me, the infection control officer, and Lana again of Human Resources. Additionally, you need to go into quarantine for up to 5 days and notify your private care physician for further instructions. Those further instructions should include how long you're going to be out on quarantine and your return to work date. Now, sometimes people are asymptomatic, meaning you have no symptoms. So that's why it's imperative that you let your doctor know of your COVID status. And then once we have that information, then we go with what the doctor says is what your return to work day. So we're going to look at this, and if you look at it right now, it's showing one red line. Now, if it was positive, there would be 2. The red is the control, and then the T is the test. If there was a positive, there'd be a blue line adjacent to that T. So presumptively, this is going to be a negative test, but in 10 minutes, we'll know for sure. So I hope this video is helpful. And if you have any questions, please don't hesitate to either call, text, email me, or if you see me, ask me in person. Thank you.